massage nerds. Today I'm going to be bringing you an introduction to foot reflexology. I want to talk a little bit about the difference between a foot massage and foot reflexology. A foot massage focuses on the musculature and the tendons of the foot, and it's incorporated within your massage. It's usually 10 minutes, after you've done a full body. So foot reflexology focuses specifically on internal organs. They're all the reflexes to the internal organs, and it's usually done anywhere from 30 minutes to 60 minutes. This comes from an ancient philosophy and practice that they believe that we have chi flowing all over our body and through channels and zones. So they divide the feet and the hands and the ears into 10 vertical lines, 5 on each foot. So we'll pretend that these are the feet. So they have 10 vertical lines between both of them, but really 5 line on each foot. And then 5 horizontal lines dividing the foot. So I'll talk and show you a little bit more on the foot. And there's really just 5 techniques that you use. And one of them, the main one, is the thumb walking, and I'll demonstrate right here. All you're doing is your distal phalanges of the pollex. So what you're doing is you're bending and dragging it, just small little tiny increments. You can go up the foot, on the side of the foot, across the foot. So this is one of the techniques. Another one is finger walking. You can go between the metacarpals or the metatarsals in the feet, just going up, and you also can go across. And then I'll show you when I'm demonstrating on the model, the lung press, and I'll show you a couple more techniques. But there's really very basic techniques. There's only 5 of them. You don't have to get fancy or anything like that. And another thing I want to mention, the benefits. The benefits is it's very important for people that are stressed out. It really helps reduce the stress, reduce pain. It's very beneficial to people that are going through chemotherapy or cancer patients that are recovering. Also, women that have painful menstrual cycles, it really does help them. So you want to stay within the pain tolerance of the client. I always stress this in all my videos. This is not about no pain, no gain. It's about being very specific and targeting those organs that you want to target. So especially in the elderly people, geriatrics, they lose a lot of their padding on their feet. So it can be very painful if you're not careful. This is a technique that you don't use oil with, so that's even better. You don't have to use oil. You just do the work dry. If the person's foot is really dry, you might put 1 or 2 drops on your hands and rub your hands and then use it like that. But you really don't need any oil, which is fantastic. So this is foot reflexology. Like I said, it's also known as zone reflexology. And if you take a 6-hour CEU class on reflexology, that does not make you a reflexologist. It's very extensive, instructions. So make sure that you take a reflexology class that qualifies you to be able to do this work. This is just an introduction to see if you like it and it's something that you might want to pursue. Hello, massage nerds. Okay, so this is what we did for you. Look. We drew all the reflexes on here. So let me show you that when you put both feet together, it makes up the whole body right here. We only drew it on one side, and this is the side I'm going to be working on. But when you put both feet together, right down, these are your vertebrae. The 7th cervical, 12th thoracic, and all the way down here to the coccyx. So they go all the way down. And the middle part of the foot also has the 4 curvatures of the spine. 1 curve, 2 curves, 3 curves, 4 curves. So it goes down just the way the thoracic spine does. We've got the transverse colon, descending colon on this side. We've got the lung, the heart, all the the brain reflex, the sinus reflex, the eye reflex, reflex. Let me show you how it's broken up. So every reflex is on both sides. However, your gallbladder is on the right side, so you would have the gallbladder point right here. The spleen is on the left side, so you would have the spleen reflex on this side. So you want to make sure and work, you need to know your chart, obviously, so that you're able to work every reflex. But right here, we drew it for you so that you can see everything that I'm going to be working on. Okay, so the reflexes on your body, they are the same as they are, on your feet. So the foot is divided into 5 parts. From right below the toes, where the metatarsals end and the phalanges begin, that's one line. Everything above that is every reflex on the head. From here to right below this line right here, this is called the diaphragm line, and it almost looks like your diaphragm, like your thorax right here. Okay, so it's everything in your chest, your lung, your heart, everything in the chest right here, your thyroid, your trachea. And then you have another line right here, the abdominal line. So this is the upper abdominal, which will be your stomach, your small intestine, your spleen, and then you have your lower abdominal area, which is your transverse colon and descending colon, and your colon here. But also on the right side, this would be the ascending colon. So you have your ascending colon and then transverse colon and descending. So somebody that has constipation, you want to work the left foot because this is the ascending colon. If somebody has problems with absorption, then you want to work on the ascending colon on the right foot. So some of them will be on the right foot, some of them will be on the left foot, but mainly they're all here, okay? Anything below the heel is anything below the pelvic line, like your bladder, your legs, your sciatic nerve, everything is here. This is a mirror image of your body. You just divide it into the upper, right, the diaphragm, the abdominal, upper and lower abdominal, and then below the pelvic area. So all the reflexes are here. Let me show you that the first thing you want to do is start warming up and relaxing, relaxing your client's foot. So you're going to take your hand, toes to fingers, and then just kind of do a little bit of a movement. And if you want to stimulate the reproductive system, you kind of do a little bit of shaking here right below the lateral and medial malleolus. Remember the lateral and medial malleolus, the medial is from the tibia, the lateral malleolus is from the fibula. So you just kind of do a little bit of a rocking motion, back and forth, okay? You can also do some figure eights. You hold at the heel and just do some figure eights. And all we're doing is just warming up, feeling where she might have some tension, just to feel where she might have a little bit of tension here. Once you've kind of warmed up your foot a little bit, now you want to start with the thumb technique. Let's say I want to stimulate all of her vertebrae. You start, remember, you're only going to use the distal phalanges, and then you're just going to go up a little bit, like centimeters at a time. And you don't lift up. You don't lift up and lift. You kind of drag it. So you drag your thumb, all the way up. Let's say she's got problems right here in her thoracic area. You might want to hold that. And when they have a problem, let's say I feel a problem right there, I brace with my right hand and kind of push a little bit into my thumb. And just hold up for a little bit. And then keep going all the way up, all the way up. Let's say she's got problems in her neck area, the cervical area. So I would, hold it right there. These reflexes are the reflexes to the brain. So you can take it and just push on it, each one. These are the sinuses, so people that have sinus problems, people that have headaches, you can directly work on the big toe. You can work directly on the big toe for anybody that has headaches or anything with their head. This is the pituitary, up here, the pituitary pineal gland. And now you're going to go across. After you do each toe, these are the sinus points at the little tip. So you just want to hold it and massage it for, a minute or so. I'm going a little bit fast just because I want to get through the whole foot. You can go across also. So I start at the edge, at the lateral edge, and just move across the first line. This is the reflex of the eye right here, right between the second and third toe right here. So I keep moving all the way to the end. So this is your first line that divides everything above here is what's in the head. This is your diaphragm line, which is very important when you're trying to relax somebody that's having problems breathing, that you want to slow down their breathing. You really want to go across the diaphragm line. And the solar plexus is right here. Again, when people are really stressed out, I like to hold a little bit, brace the foot on top and just put a little bit of pressure there right at the solar plexus. And then keep moving all the way to the end. This is the diaphragm line. Here's the lung. You can do some extensive, this is the chest area right here. Remember, this is the chest area where you have your lung and your heart. Your heart is in the center of your chest. However, the apex of the heart is leaning towards the left side. So you can work the heart reflex, right here. The lung reflex. This is the trachea, the thyroid reflex. As you start coming down right below the diaphragm, this is the diaphragm reflex right here, all the way across. Then you get into the stomach. Now we're going into the upper abdominal area. So you want to work, let's say, the stomach. They're having digestive issues. So you want to work all the way across. The stomach is a J-shaped organ. So you want to work right here at the upper abdominal. Your small intestine is right in between your large and your stomach. So you want to go across. And you can also go up, but I'm just showing you across. Like now I'm going to get to the transverse colon and descending colon. So you want to go from one side. I should be doing it from this side, but for the sake of the angle of the camera, I don't know if you can see, but you want to follow the way the large intestine goes, which is transverse colon and then descending colon. Descending colon is the one that evacuates, is the one that helps you eliminate. Remember that your large intestine is the one that reabsorbs all the water that has not been absorbed in this. It's the job of the large intestine to reabsorb the water. So you want to make sure and come down right here, down the descending colon. And like I said, all I've done so far is just really use my thumb. It is very thumb intensive, guys. And this is one of the reasons why I don't do this anymore, because it really got to hurt my thumbs. Now, if you've got somebody that has problems with their bladder, you want to stimulate. And like, again, you can push the foot, a little bit more into that bladder reflex. And gently, you don't have to do it really hard. Also, somebody that has sciatic nerve pain, you want to make sure and work by the heel if they have sciatic nerve pain. All of this involves the lower part. This is the lower part. This will be the legs, the knees, the sciatic nerve, goes all the way to the heel right here. So you want to make sure and get to the tarsals, okay? These are the metatarsals and then the phalanges. So it's the tarsals, metatarsals, phalanges. And so as you can see, here's the lung, the heart, the stomach again, the small intestine, large intestine, continued small intestine, and then the vertebrae right here, the eye reflex, the shoulder reflex sometimes. Some of you might ask, well, when do you know, when do you know when to do reflexology? One of the things that I say, let's say somebody was in a car accident and they injure their shoulder, and you can't really work on it because they still have, hematoma, still have, an injury there. So this is the perfect time to go to the reflex. When you cannot work directly on that shoulder, then you go to the reflex. You go to the reflex of the shoulder. Somebody had eye surgery. Well, you can't work their eye. You go to the eye surgery. To the eye reflex. Somebody, is really having too much pain where, let's say in the sciatic, coming out of the lumbar area, and they can't even handle any pressure. Well, then this is the perfect time to go to the reflex. I always say, if you can actually work that muscle, go to that muscle and work that muscle. However, there are times when you cannot work that muscle, so you go to the reflex on the foot. This is very appropriate to use when you cannot work that reflex, on the body. Then you go to the foot. And remember, foot reflexology targets internal organs. A regular massage, foot massage, is when you're working the muscles and the tendons. Okay. Another one that I want to show you is the lung press. You put a soft fist right at the chest area. Put your thumb in between, right here. Grasp the foot, and then just press. This is the lung press. So putting your thumb in between gives you a little bit of more pressure. And you're using your knuckles. This is another one of the techniques, the lung press. So you've got the thumb walking. The finger walking is mainly done on the top, on the dorsal part of the foot. So you're just walking in between all the metatarsals. Right here, you're just walking down. And this also targets the lung, the chest area on the top of the foot. So you just walk all your fingers down the top of the foot. Another one too that you can do is the dorsiflexion and plantar flexion. Dorsiflexion and plantar flexion. This will also help to start loosening up the foot. And if you need to use a little bit more pressure. And remember, you don't need oil. This is a whole treatment, guys. This takes about an hour to just focus on everything, every reflex of the body. They're also called zones. Like somebody that's got a lot of meaty part right here on the heel, and it's hard for them to get to their sciatic reflex. You might want to use your knuckle, and just get in there and hold it there, and always make sure you tell your client to breathe. And after you're done, I also like to do some spreading, spreading the metatarsals open. And some cross fiber here. And you're trying to get movement and target certain trigger points. And the vertical lines, I talked that at the beginning, that they divide, the vertical lines 5 on each foot. So it goes from in between each toe all the way down. And these coincide with the 10 meridians, the lung meridian and all the kidney meridian, so, I forgot the spleen. The spleen would be on this side right here on the left foot, and the gallbladder would be approximately right here on the right foot, because the gallbladder's on the right and the liver's on the right. You can work it from here, but it's better if you work it on the side that it's on. So it was better if you work it on the right foot. But there you have it. This is all the reflexes to your body are right here at the bottom of your foot, also on the bottom of your hands, and they're also on your ears. So this is an ancient, philosophy, and techniques. So I hope this helps you and helps you decide if you want to become a reflexologist, if this is something you're interested in. It's really pretty awesome and amazing. So until the next time, create a great day.